Ty, let's say someone is diagnosed with cancer. I know a lot of cancers are different, but when we go to the traditional doctor, we get a sense of panic right away because we're told you got to start this and you got to start this
Hmm.
now. Um, is it true that you can really take some time and think about what your own protocols and therapies are going to be, because the cancer may have been there for months, if not longer, where you don't really have to rush into a decision like that to go get surgery tomorrow?
Um, it depends on the type of cancer.
Mm-hmm.
So I'm dealing with a friend of mine in New Zealand that's got a brain tumor. That's something you might have to act on quickly. But typically, I would say that people should empower themselves with knowledge, which is why I wrote the book, so people would have the knowledge and be able to intelligently discuss their cancer with the doctor once they're diagnosed, as opposed to not knowing anything and going into the doctor's office, because then you will feel that sense of urgency and you're going to do what the doctor says when he says it. So you got to learn ahead of time, and then you can intelligently discuss with the doctor. And there may be, you may be in a situation where your whole body is overtaken with cancer and you got to do something quick.
Mm-hmm.
Or it may be a situation where the doctor sees a spot on your leg that might be basal cell, and that's not something you should lose a lot of sleep over that night. So it depends upon the stage of the cancer. Depends on whether it's, stage 1, stage 4.
Mm-hmm.
Stage 4 is metastasized and is in your lymph nodes, and you better do something quickly there. And I'm not saying you should go get surgery or you should go get radiation or chemotherapy, but if you have stage 4 cancer that is spread, you better act quickly.
Mm-hmm.
I would act quickly with a natural treatment, or a couple of natural treatments combined, or 2 or 3 different herbal supplements combined. But you better act quickly if you have stage 4 cancer. It's not nothing to mess around with.
Mm-hmm.
So it depends upon the stage of the cancer. I guess the answer to your question is it depends
Mm-hmm.
on the stage of the cancer.
So along the same lines, then, what's your thoughts on an early diagnosis and going? If you're 40 years old, you need to do this, this, and this every year, and we all have those guidelines that we're supposed to do. What are your thoughts on doing things like that?
You mean going to get
Getting a colonoscopy when you turn 40, and the varying ages
all
of
of,
of breast
yeah,
mammograms and things like that. And
sure.
do we need to be doing that every year? And how important is that, do you think?
Well, for colonoscopy, you risk
Mm-hmm.
serious problems of perforation with colonoscopies. So you can have numerous medicinal medical problems that can be caused from the colonoscopy. Let's look at breast cancer specifically, because you mentioned
Mm-hmm.
mammograms. Should you go each year to get your mammogram once you hit 40? No. There's better testing alternatives than mammography for uh, detecting breast cancer. Thermography is much better. It's where the doctor runs cool air over the breast, and the cancer cells don't react like normal cells to the cool air, and so they'll stay hot. And then the thermography, just looks for hot spots in the breast, and so after the cool air is run
Mm-hmm.
over the breast, the hot spot remains. And thermography can actually detect breast cancer years in advance of mammography. The problem with that is that all the money's in mammograms. If you look at the money that's generated each year with mammograms, it's astounding. Mammography actually causes cancer, because what are you doing with the mammogram? You're radiating the breast. It's radiation.
Mm-hmm.
And there have been many studies out that have shown that certain types of cancer, I think it was uh, DCIS, which I can't remember what the acronym stands for, but it's a certain type of breast cancer, has increased 300 to 400%. Ductal carcinoma in situ has increased 300 to 400% since mammograms started. There are numerous studies that have been done to show that mammograms cause cancer.
Mm-hmm.
So should you go get your mammogram? I say no. Don't get a mammogram, get a thermogram. But your insurance probably won't pay for it. So
Mm-hmm.
mammography has been shown to cause cancer. So that's one issue. Another issue with breast cancer is not really on topic as far as the screening,
Mm-hmm.
but there have been many different studies that have shown that one of the causes of breast cancer is bras. Because
Really?
what's right underneath your all breast cancer start on the edges. What's right there?
The wire, yeah.
The wire. And what's underneath the wire? Your lymph nodes, your lymph glands. And so your lymphatic system is one of your primary detox systems in your body. You have your colon, of course, detox to your colon, your
Mm-hmm.
skin, detox system, and your lymph nodes, your lymphatic system is a detox system. What happens with women that wear a bra? the lymph can no longer flow under there, so the toxins build up, and that's where all breast cancers start. There was a book that was written. It was called Dress to Kill, and it was by two Swedish women that did studies on breast cancer in relation to bras. And I believe that it was, if a woman wore a bra 24 hours a day, she had a 1 in 4, 1 in 5 chance of breast cancer. Women that wore bras 12 hours a day, only half of the day, it was like 1 in 15 or 20. Women that almost never wore bras, it was 1 in 168. I mean, they did some pretty good research to show the link between breast cancer and bras. And the reason is the bras that have the wires go right into your lymph nodes, and the lymphatic system is no longer able, the fluid doesn't flow, and you're not able to detox.